In terms of an upper lid procedure, an upper lid blepharoplasty, the incision is often placed in a crease in the eyelids that we identify at the time of surgery. I'm able to remove not only the skin, some of the musculature, and if need be, not as often as we once did in the past, a little bit of fat that's involved in that location. Then repairing the area with some fine suturing really does help create the aesthetic that patients are looking for in this circumstance. Lower eyelids, those are more complex, those are more involved. They often require either some form of general anesthetic or deep sedation where the patient is thoroughly under anesthesia because it's a bit more discomfort for our patients. In that setting, we're able to access the eyelid through either the skin or at times inside, called a transconjunctival. So we have two options. There are incisions that go right underneath the eyelashes in the lower lid, or we can go within the actual eyelid and hide the incisions entirely. Different patients are different candidates for different procedures in that circumstance. Crucial to the lower eyelid is to be very judicious and cautious with the amount of skin we remove. The effort here is to reduce the risk of post-operative headaches or complications where the eyes may pull a bit. There are treatments for those, but if we can minimize or reduce that risk in the perioperative phase, better to do that. During the lower lid blepharoplasty, the goal here is to really achieve some improved aesthetic. One is to tighten the skin if needed. Two is to remove fat if indicated. And three is to reposition fat to a location where it better serves the patients. Meaning we want to blend what's called that eyelid to cheek junction so we have a much more natural aesthetic in that setting. That procedure takes a bit longer than the upper lid blepharoplasty, normally about 45 minutes to an hour for upper lids, about an hour and a half, possibly 2 hours for lower lids when done properly. Patients still go home the same day, but they do vary in terms of anesthesia. Of course, these two procedures can be done together at the same time, and patients do exceptionally well in that circumstance. In terms of the post-operative care, what you can expect. Cold compresses are used early on for limited periods of time, but this helps reduce swelling. We avoid strenuous activity, no lifting, pushing, pulling. We will be given prescription eye drops and ointments, and usually patients follow up within the first 72 hours to keep an eye on how they're healing. Complications that could be associated with this procedure might be some swelling, some bruising, dry eyes, which we've often identified prior to the procedure and may need to manage at the time of the procedure. Sometimes there's some imbalance that may need required addressing, but very rare in those circumstances. Please enjoy some of the before and after photos.